Hello guys, now we shall be discussing about the yellow fever virus, right? Very important. Now yellow fever virus, it comes under which group of viruses guys? It comes under Flavivirus, right? So it comes under which group? Flavivirus. Yellow virus is transmitted by which mosquito guys? It is transmitted by Aedes mosquitoes. Okay, now like Aedes aegypti, I hope you know it. Now what is the reservoir? The reservoir can be human or it can be monkey. It can be human or it can be monkey. Okay, now when it comes to the symptoms, obviously any infection you take, viral, bacterial or protozoan, any infection you take, fever is common. But what is uncommon here is that in these patients of yellow fever, there will be black color vomitus. Okay, not only black color vomitus, patients will also have jaundice. So whenever any patient is coming with the jaundice, what you need to do to evaluate it, you need to take the biopsy of the liver, right? What is wrong with the liver, why there is jaundice, and also for that reason you need to take the biopsy of the liver. Now when you take the biopsy of the liver, in those patients with yellow fever, right, you would find Councilman bodies, right? What are these Councilman bodies? Look here, all these are hepatocytes. Okay, so all these cells over here, they are individual hepatocytes like this. Okay, now in between the hepatocytes, can you find these cells like this? Can you find such cells over here? These cells over here, right, in between the hepatocytes. So another here. So these cells are called as your Councilman bodies. So Councilman bodies are found in case of yellow fever virus. So this is all you need to know regarding the yellow fever virus. Thank you so much for watching my video.